Hello, and welcome to today's RiseCast, where we share tips for improving immunization rates from Rise to Immunize campaign participants. My name is John Kennedy, and I'm Chief Medical Officer for AMGA and President of the AMGA Foundation. Today, we'll be hearing from Tristan Sadowski, Assistant Director of Geisinger Pharmacy, Retail, and Mail Order. Tristan, thank you so much for joining us today.
Thank you for having me today.
So we understand that Geisinger has created a pathway for administering Medicare Part D vaccines, such as RSV, Tdap, and zoster vaccines in a clinic setting. Tell us a little bit about the reasons for establishing this pathway.
Really, one of the challenges that we found, particularly with vaccines covered under Medicare, is the Medicare pathway requires billing to go through a pharmacy, which while we do have pharmacies as a solution, I think the biggest reason to address this concern or challenge is that in current state and how most health systems are addressing is it does require the patient to make an additional stop on their visit to have that vaccine care gap addressed. So we saw opportunity to improve the process to not only address that care gap for the patient, but also, give reassurance to our health system that that care gap was indeed addressed in the moment.
So tell us about some of the steps that were required in order to establish this type of infrastructure at Geisinger.
So for me, it step one really was establishing a pilot group. Finding a good location that not only had a high demand, but also that had the right energetic group that was interested in taking on this challenge. Beyond that, it requires a lot of education, I will say, addressing education to the teams of what vaccines go through this pathway. Some of them could still go through your traditional billing in a clinic setting. What does that process look like? What are the roles for each team member participating, and just tailoring that education to the various teams participating.
So after administering the vaccine, can you tell us a little bit about how the system then will adjudicate the claims to ensure payment for Medicare Part D when it's given in an outpatient clinic setting?
One of the things that we have going for us is, particularly with Medicare, is the Affordable Care Act guideline that these vaccines do have to be covered, for no charge. So the adjudication process for us takes place, prior to the patient receiving vaccine. Essentially, patient is consulted about, the vaccine need, whether it be Shingrix, whether it be Tdap, whether it be RSV. And if they're interested, there is a communication pathway that exists between the on-site team and then our billing team to address those billing concerns or possible concerns in real time.
Well, wonderful. So since establishing this process at Geisinger, what have you seen in terms of any feedback from the providers or the patients, or any impact on the number of vaccines that are being administered?
So to talk about, first off, it took some time to win engagement from the group. As I said earlier, we have an existing process that could be used, but there was definitely opportunity to improve. So as we've seen the impact of this process, the win for the patient, save them the additional stop, be able to address the care gap there, and then also the outcome of the provider having confidence that they're able to address that care gap in the moment has really helped us gain momentum over time. And that snowball keeps rolling. Vaccine numbers do continue to climb as we continue to gain confidence in this program that we have.
Tristan, thank you again for sharing these great insights on improving immunization rates among your patients at Geisinger by utilizing the Medicare Part D vaccines in an outpatient clinic setting.
Thank you for having me.